Hi, everybody. Thank you for being with us. We're going to get some important information about coronavirus right now from Dr. Joe Suyama, who is the Chief of Emergency Medicine here at UPMC McGee Women's Hospital. Dr. Suyama, thanks so much for being with us.
Thank you.
And a lot of these questions are coming from you, by the way. We asked you to submit your questions, so I'm just going to get right to it. And here we go. Other than washing our hands, what other precautions should everybody take right now?
Absolutely. I think you brought up the number one thing that people can do individually to decrease the chances that they'll pick up any infectious disease, particularly the coronavirus. As we see now, there are communities that are affected greatly, and as we see social distancing policies put into place, doing our best to abide by those regulations and those rules that are being set forth is also something to be considered.
Washing your hands, and you just mentioned social distancing. That's important, isn't it?
Absolutely. I think we all have, two things to focus on during this pandemic. Number one, our own or our individual health and safety as well as our family, and then what we can do to provide the general public the best outcome from this pandemic.
How much easier, or faster, I should say, is this spreading compared to the seasonal flu?
So this is obviously a very evolving and dynamic situation. Truthfully, we won't know those exact numbers until the end of this pandemic. But as you look at the current data that we can look at from China and mostly internationally, we do feel that the coronavirus has a slightly increased risk of spread between individuals. The actual numbers you might see from the literature are approximate, but for every single person who has coronavirus, the actual disease, there is to be expected a 2.2 or just above 1 to 2 people who will get the disease, whereas influenza may be just above 1. So my chance to infect another person is just above that 1-to-1 spread.
You hear a lot of people, and I know I do, who say, well, the flu has killed way more people. Far many more people are sick. Why are we going so crazy with coronavirus?
Absolutely. And I think you hit on a very important point. Influenza is a devastating illness, and we should take that very seriously and continue to do so. The fear about coronavirus is that we don't know the exact extent and the potential health effects it will have on individuals and in communities. So it's that unknown. A disease that is spreading through a community that has no innate immunity is of concern because there's a chance that everyone could be susceptible. And if you take even a very low mortality rate, that could be a lot of people when you start multiplying those numbers.
If a person has symptoms, they think they may have it, where should they go to get tested? What should they do first, actually?
Absolutely. I think that's really good to take a step back and think that testing is not the ultimate goal here, right? It is to make sure that your health and well-being are taken care of. And so the first person you would generally go to is your primary care doctor. Your doctor knows you the best. They know your risks because it's true that underlying medical conditions or even age greater than 65 are known to be greater risks for you if you get the disease. So I think the first step is to talk to your doctor and to see if you even need a test.
But talk to them, don't just walk in unannounced to the office, correct?
I think with clear messaging, both from the media as well as through social media, I think that we can get the right message, which is to communicate as well as you can to your primary care physicians, and in fact maybe utilize telemedicine options instead that will allow you to talk to a physician or another provider via the internet so that you can get good clinical medical advice and maybe direction on where to go.
And this also goes for ERs in hospitals. Don't just walk in, correct?
Absolutely. And I think the criteria to use the emergency department under the circumstances of a pandemic are really important to understand. We are there 24/7. We will take care of anyone at any time, and we'll do so today, and we'll do so during this pandemic. What we do think is communicating ahead of time so all ERs who are currently prepared can get everything in order, maybe even meet you outside. Those are all things that we can put into place if we have a heads up.
Okay. Are there specific criteria for a test? Let's get back to the test. Are there enough tests?
Yeah, so the testing volume, as you can see, is going up throughout Pennsylvania, throughout the country. So the availability is increasing. As I think of today, there were greater than 300 tests performed in the Commonwealth, and as you saw, an increased number of positives have been coming back. As far as the tests that we have requested through UPMC, they've all been granted with collaboration with the Department of Health. So far, the people that we've wanted to have tested have been tested.
And again, if you're thinking you need a test, I mean, how bad do you have to be with symptoms?
And it's true, when you have symptoms that are very vague, upper respiratory is a myriad of symptoms.
Shortness of breath, right?
Shortness of breath is something that's characterized in the influenza, but in the context of COVID, or when we're worried about the actual pandemic disease, we worry about the highest fevers in the setting of shortness of breath or difficulty breathing, where your function is going to be declined. And so when you actually feel those symptoms, or if your cold or mild symptoms worsen in, say, a week's time frame, that's the time to seek care and potentially get tested.
What about people with underlying health conditions who are younger than 60? I hear the cutoff at 60. What for those people should they do?
So, as you know, everybody has their own underlying health concerns. They may actually take care of an elderly person, and so you have to always put those things into consideration. But there is a difference between being susceptible to the disease and vulnerable to the disease. We're all susceptible, so we need to be careful and cautious out in public, to use our judgment as far as where we go, when we go, and to understand any risks based upon local messaging, so we don't put ourselves in harm's way.
We hear about self-quarantining, staying home. At what point should someone think about self-quarantining?
Well, obviously, if you have been directed by your public health authorities to self-quarantine because of epidemiologic risk or symptoms that you might have brought up to them, that's a directive that you should probably take to heart. And other reasons to quarantine, you should probably make sure you run that by a healthcare professional to make sure you're doing the right for yourself.
What about pregnant women? What are their concerns? Obviously the baby, but
absolutely,
how serious is that?
We talk about this daily. This is a very high priority for the physicians and the administration here at McGee.
Sure.
So one of the things that we know about infectious diseases is that pregnant women, they have a slightly changed immune system. Their lungs are slightly different, and so that puts them at greater risk for infectious diseases in general, specifically the respiratory ones. And so we treat the patients who are pregnant that have influenza. We are very concerned and serious about them. And until we have other directive, we will also make sure that our pregnant women are also given the highest regard under these conditions. But as we know now, the good news is that there hasn't been data that show that there's increased morbidity or mortality related to the pregnancy status and COVID.
If someone is in a hospital and they test positive, what then happens? Immediate quarantining, I'm imagining.
Well, the good news is it doesn't come out of nowhere. The patients are very sick. They are likely in respiratory isolation because that's where they need to be from their presenting symptoms. And so it's highly likely that these patients are already in an isolation or private room. The providers have been protected, as well as nursing staff, to make sure that they have not been exposing themselves to even influenza or something similar. But when obviously the test becomes positive, then they can be even placed under greater scrutiny and perhaps moved even to a higher level of care.
Okay, and if someone tests positive, give me the recovery period, the timeline of it. Is it weeks at least, and how are they going to feel differently than, say, the flu?
So the difference between influenza and the severe coronavirus infections are the extent of the lung damage that occurs. That will become very evident because those people always require hospitalization. But the good news is the literature, and if you look at all the cases across the world, greater than 97% of the people recover,
right,
and even about 90% will sort of shrug this off as a fairly mild illness and can do so at home. The problem is this ability to contaminate their surfaces in their environment, as well as then spread the disease to people who may be not as lucky as them from their response. And so the suggestion is to be quarantined or to be isolated if you have the disease for the time period that you're symptomatic, and then if you truly have the disease, there will be some clearance that may need to be done with further testing for you to go back into society.
But it can take weeks.
It can.
Okay. Should those who are elderly take any precautions? And I'm not talking to right at 60, a little older than 60, I'm 62.
Mm-hmm.
Should they go to work? Should they go to stores and go out? Tell me what they should do.
Again, The individuals should probably keep in mind the risk factors that have been put out there, which includes age and underlying comorbidities such as COPD or diabetes. But the point is that the vulnerable population should always be wary, specifically any communicable disease, influenza included, and I would have them think about this in that same context.
What about the rest of us? I mean, there's the Home and Garden show this weekend. I think there's still some Broadway type shows, although I think one got canceled. But, gathering places where there are going to be a couple hundred or more people, should we not go to those right now? What do you think?
Well, those decisions may not be up to us anymore, as you will probably get directives from local and state public health authorities. Social distancing can be enforced upon us. Mm-hmm. And so the unfortunate thing is if these events are to be closed or limited, I suggest we follow those directives.
Okay. No positive tests so far in Allegheny or all of Western Pennsylvania. Is it a matter of time?
That is correct. No test as of now, but I do believe because of the current circumstances, it is a matter of time.
And the last question, this just happened. A couple of school districts have closed down. Do you support that sort of decision?
Like I said, I think we have two things in mind: our individual and our family's health and safety, and then what we can do for the public's greater good. You've probably heard the term about flattening the curve. That's a responsibility that we can take very seriously, and part of doing that and decreasing the spread of this disease in our communities is to listen to our public health officials, and if there's a closure, to support it, and to make sure that we do everything we can to support the general public's health.
Last thing. You're a medical doctor, you're in charge of emergency services, you're well-versed on all this. How concerned are you about coronavirus?
I have great concern about this disease because I think that as we look at the current state of our country as well as the lessons we learn from the rest of the world, we are only at the beginning of this. And so the actions we are taking today, we'll only know the benefits in a week or two. And so it's very important for us to take it seriously today so we don't have something that goes out of control.
But I think I'm also hearing you say, don't panic.
That's correct.
Listen to what you should do, take that advice, and don't panic.
Yep. We all have our duties that we can perform, whether it's simply washing your hands or listening to our public health experts about social distancing, and obviously utilizing your health services responsibly, making sure you get your symptoms taken care of, but also not to panic.
All right. Dr. Joe Suyama, thank you very much for your time. I'd shake your hand, but that wouldn't look good. So I hope that helped everybody. It's always great to get this sort of information from a medical professional. Thank you for listening.